Over the last 50 years, care at the end of life has evolved into a highly specialized medical field called hospice care. Most hospice care is delivered at home.
The focus is on treatments that are aimed at providing comfort, relieving suffering. We're talking about how can you do as well as you can for as long as you can with this disease or diseases, but we're also talking about how can you make the most of the gift of this time.
To be considered eligible to receive hospice care, a person need be assessed by at least 2 physicians who believe death can be expected within the next 6 months if an illness runs its expected course. Medicare provides benefits for hospice care. In recent years, innovations adapted from hospice care are being expanded to benefit patients suffering from a chronic condition who may live for any number of years. This emerging field is called palliative care.
Palliative care is a very new field. When I was a resident in training in the late 90s, it didn't exist.
Most palliative care is delivered in the hospital setting.
Palliative care, if you think about a really large umbrella, is the whole group. It's taking care of symptoms, taking care of anybody with an advanced illness, and it's a multidisciplinary approach, so having not just doctors but nurses, social workers, chaplains, all trying to take care of a patient and their family and trying to maximize their quality of life. It's about what their goals and values are.
Both palliative care and hospice have developed during a time when chronic illnesses have replaced acute infections as the world's leading cause of death, primarily due to advances in medicine and medical technology in the last century.
Now, the consequences of that is inevitably we will all develop chronic illnesses, usually lasting for a year or 2. So we are facing some real challenges in how healthcare is actually delivered.